What's up, beautiful people? Welcome back to my channel. Before I jump into this video's topic, I just want to go ahead and say thank you to all of my new subscribers. I believe I made it to 1,000 subscribers. I am super excited about that. I really did not see it coming so quickly, but you guys have definitely helped me along the way, and I just want to say thank you, thank you, thank you. In this video today, of course, we are going to discuss a nursing topic, and this video I am going to tell you all about home health nursing. And I'm choosing to talk about this topic because I've had other people in the past ask me about my experience about being a home health nurse. I've also had people reach out to me on TikTok asking me my take on home health nursing. So I said, you know what? It is time for a video. So let's go ahead and get right into it. If you are new here, my name is Kendra. I am a registered nurse. I have been a nurse for 12 years and I have worked in a variety of settings. I have done med-surg, telemetry, IMC. I have done a little bit of management in the home care setting. I have also worked as a home care nurse for numerous years. Currently, I do work in the ICU, but today, like I said, we're going to talk about home health nursing. So how I first got into home health nursing, it was about back in 2013, I want to say 2013. Yes, I was working on a busy IMC unit. And let me tell you, I was super burnt out. And I had applied to go into their ICU, and of course I was denied, and I will tell you guys that story in a whole nother video. So when they declined me from getting the job in the ICU, I decided to resign and I applied to become a home health nurse. I was very tired of the bedside, super burnt out, and I heard a lot of good things in the past about home health nurses. So I said, let me go ahead and apply and see what this is about. I applied for the job and I was hired with a very popular company here in the Maryland area to be a home health nurse. The application process was pretty easy. I went online to their website, filled it out. They called me back in, did an interview, and I think they hired me. They were excited to hire me because I also had a master's degree in nursing education. So a lot of the home health nurse responsibilities is to provide education to the patients that they're seeing at home. So they were very excited to hire me, and I was excited to get started for many reasons. So let me go ahead and give you a little bit of background on the reason for home health nursing. I don't think a lot of people realize, or a lot of nurses realize, how much of an important role home health nurses play in keeping patients out of the hospital. So as you guys know, government is always meddling in healthcare. And one of the rules, I guess one of the Medicare, Medicaid rules is that if a patient gets admitted to the hospital and they get treatment and they're discharged, if a patient gets readmitted back to the hospital under 30 days, the hospital has to eat the cost. They will not be reimbursed because it's under a 30-day readmission. So the whole point of home health nurses is to keep patients from going back to the emergency room and to keep patients from getting readmitted, specifically underneath that 30-day period, because hospitals do not want to lose money. So it is cheaper to pay home health nurses to go out and attend to patients in the home instead of having patients continuously return to the ER. Do a quick location change. I'm sure you can tell by the background. But let's go ahead and jump right into the benefits of being a home health nurse. This is just my take. It is not everyone's view, so just take this with a grain of salt. One of the benefits is the scheduling. So as a home health nurse, you work Monday through Fridays, and you don't do any weekends unless you have to cover weekends. And it's usually in rotation, and you'll get that schedule in advance. And a lot of home health companies are pretty flexible as to the weekends you want to cover. I think some companies, like the last company I worked for, the nurses had to cover two weekend days in like a 4 or 5 week period, which isn't bad. It could be a Saturday or like a Sunday, and the nurses usually work it out. But your schedule is Monday through Fridays, and usually you work office hours. You should be available office hours. So if the office opens at 8 a.m. and closes at 5, they expect for you to be available during that time. Keep in mind though, you have a lot of flexibility with scheduling because you're going to see a certain amount of patients each day. And it's up to you. You have a lot of autonomy with moving patients around depending on, how often they need to be seen, depending on their acuity. You can say, all right, I'm going to see 6 patients today, 5 patients tomorrow, 6 on Wednesday, 4 on Thursday, and maybe 3 on Friday. The home health agency will assign you a certain amount of productivity points that you need to meet for the week, and you can basically play with it, because in home health, each visit is worth a different amount of points. So for example, if you're going to do an admission, which is admit a new patient to home health, that can be 2 points. If you're just doing a regular revisit, that can be 0.75 points, or like 1 point. It just depends on the agency. If you're doing a discharge can be 1.5 points. So let's just say that you have, let's just say your productivity points should be 25 points a week or 27 points a week. You can basically figure out how many patients per day you need to see. And that gives a lot of flexibility. I've known home health nurses that start their day super early, like maybe 8 o'clock in the morning. Depending on the patient's needs, some nurses will even get there for 7:30 before the office even opens. And that's usually an agreement that's made between you and the patient. Some nurses start their day a little bit later, maybe 10, 11 o'clock. And usually, even though you're scheduled for office hours, like from 8 to 5 or whatever the case is, you're usually done. Like, you're not usually doing a full 8 hour of physical work. Sometimes you will start your day at 8, and some nurses will end as early as 1 p.m. and use the rest of the time to finish their documentation. So there's a lot of flexibility once you get used to it, and once you get the hang of home health, there's a lot of flexibility. It is great for nurses that have families. For example, if you have small children that you need to drop off to school or pick up from school, home health is a great option for those of you that need to be there for your children, or if you have to care for like an elderly parent or whatever the case is. Home health is very flexible as far as that is concerned. Benefit of being a home health nurse, and this can be maybe a negative and a positive depending on the kind of person that you are, but you work alone. So unlike being in the hospital setting or in the clinic setting or in long-term care setting, you have coworkers to support you along the way. No, you're by yourself. So if you're a person that likes to work independently, you're more so an introvert than an extrovert, and you just like to go and get the job done and be done and don't have to bother with the politics, unit politics, and all that kind of stuff, home health is also a great option because it's just you. You plan your schedule, you go out and see your patients by yourself, you interact with your patients, do the education that's needed, and you go home. There's no one there with you. The only time you would have to interact with your coworkers is if Joint Commission is doing their visits and your supervisor has to come out with you, or if you as the registered nurse is going out to do a supervisory visit on your CNA or your LPN who's also assigned to that patient. That might be the only time you interact with your coworkers, but for the most part, you are alone. The benefit of home health nursing is that you are very autonomous. Because you are by yourself, the office staff, the physicians, whoever is involved in that patient's care is dependent on you. So you are here and the physician is here, meaning that most primary care doctors, they're aware that their patients have a home health nurse coming to see them. So that physician is pretty much open to any suggestion. They listen to home health nurses because, like most physicians have said to me in the past, you tell me what you think because you're the one in the home with the patient. You're the one that's seen him twice a week or 3 times a week. I saw this patient last month, so I don't know how things are progressing. So if you think this patient might need an increase in his Lasix dose, or if you think I need to add or increase or decrease his blood pressure medicines, then so be it. I'll follow what you're saying because you're the one that's there seeing the patient. So you tend to be very autonomous. Like, as far as like wound care is concerned, if you're going to see a patient that has a chronic wound, or even if it's a new surgical incision that you're taking care of, you can call the doctor and say things like, all right, I think this wound is deteriorating. You can suggest certain treatments once you consult with your wound nurse, of course, because most home health agencies have a wound nurse working there. Once you speak to your wound nurse says, okay, go ahead and try this. Call the doctor, ask him, tell him that we're going to switch to treatment. You can do that. You can call the physician up and say, hey, Mr. Jones' wound is not looking too good. Instead of using hydrogel, we're going to switch to calcium alginate. And most primary care doctors are like, okay, sure, like go ahead and you guys take care of it. They sign the orders because also, even though we are autonomous within the setting, we still have to work underneath physicians' orders. And of course, we're nurses, right? So that's an expectation. But for the most part, like I said, most doctors trust the nurses that are in the home. So you have a lot of autonomy. Benefit for me, I actually loved this aspect of being a home health nurse. You get to be outside. You're not stuck behind the four walls of the hospital. And let me tell you, I loved doing home care in the summertime. Why? Because you get up in the morning, it is nice, it is bright, you get dressed, and you hit the road and you start seeing your patients, and then you're done. Usually by like maybe 2 o'clock I would be done. I would do documentation until like 4:30, and then I have the rest of the day to enjoy. I enjoyed being outdoors. Like, you run into so many different characters, you see a lot of things on the streets, you can stop and you can get your coffee, you can go to Starbucks, you can sit at a restaurant and have lunch in between. So I love that aspect about being a home care nurse. As a home health nurse, you are also playing a huge role in that patient's lives. Like, you're doing so much education, you're doing so much teaching to the patient, for the patient and for their families, to keep them from going back to the hospitals. Most patients don't enjoy having to go to the emergency room. So you're making a difference in their lives. One of the biggest things I enjoyed about home health nursing is the education that I was given. A lot of patients in the community just have no clue about their medical diagnoses and their chronic illnesses. They just don't know. So by going into the home and providing education, little bit by little bit by little bit, the patient gets to be in charge of their care. For example, CHF education, which is congestive heart failure, is one of the biggest reasons for hospital readmissions. So whenever I have a patient who is a CHF patient, whether it's a new CHF or a CHF exacerbation, going into the home and just teaching the patient the importance of daily weights, teaching the patient how to read food labels, how to minimize sodium within the foods, giving different food choices and food options, just helping that patient overall manage their health. It's very rewarding to see patients take control of their lives, control of their health, and stay out of that emergency room. So that, for me, that was, I think, the best part for me about home health nursing, is just empowering my patients and their families. As a home health nurse, I also acquired a lot of skills that I did not get working in the hospital, specifically wound vacs. When I tell you your girl could change a wound vac with her eyes closed, nobody could tell me anything about wound vacs. And ostomy care, because ostomy care is really big too in the home health setting. While it's not my favorite, I know a whole lot about ostomies, because like I mentioned earlier, a lot of home health companies have a wound ostomy incontinence nurse that works with them, that will come out and do a lot of teaching, or that will do co-visits with you if you have a patient that has a very difficult wound or a difficult ostomy. So learning so many skills. Even though I worked home health, I always stayed PRN in the hospital. And I remembered one time, one of the nurses had a patient that had a wound vac, and the wound vac kept dinging, dinging, dinging. It was no longer suctioning, it was not working. And they were paging the surgery team. Of course, they could not get in touch with them, and it was the weekend. And I said, do you need me to change it? First of all, let's go back. Most hospital nurses don't even realize what to do in the event. They don't know what to do in the event the wound vac isn't working. When a wound vac stops working, you remove it and you put a wet to dry dressing on. That's basically what we do in the homes, and that is the recommendation. So for example, if I have a patient that's on a wound vac, over the weekend the wound vac is not working, we can't get a nurse to go out, we teach the patient how to remove the vac and apply a wet to dry dressing. So anyway, so yes, this nurse kept complaining about the wound vac, and I was like, do you have supplies in the room? And they were like, yeah, why? I said, because I know how to do wound vacs. You do? Yeah, I was a home health nurse. So of course I went in and I did the whole entire dressing over. And of course the wound vac started working again, because your girl knows how to do wound vacs. And had it not been for me being a home health nurse, I would have had no idea. So in home care, a lot of people tend to think, oh, you're just doing home health. No, there's a lot of like hands-on skills, especially like as it pertains to wound care. Home care nurses have wound care down packed. And I know a lot of you might agree with me on this. The last reason I am going to talk about why home care nursing has a lot of benefits. It's kind of piggybacking on one of the reasons that I recently gave. It has to do with if you're a parent or if you are taking care of a sick family member, like an elderly father, an elderly mother, or whatever, an aunt, an uncle, or if you have school-age children, home health works perfectly because you can schedule yourself. For example, if your child is having a play in the middle of the day and families can attend, you can actually schedule yourself to stop by the school to go see that play for the 30 minutes and then continue on with your day. Home health nursing works great for parents because your child might have a soccer game in the evening time. And you all know if you're working in the hospital 7 to 7, you're not making that game, because trust me, I have fallen victim to that too many times when my eldest daughter played soccer. So once again, I can't emphasize the flexibility in the scheduling that home health offers, especially if you're a parent. So those are the benefits of being a home health nurse. I will do another video talking about the con side of being a home health nurse, because like with everything, you have positives and you have negatives. I'm not only going to give you just the positives and rant and rave of how awesome home health nursing is. I'm also going to give you the downside, but that is going to be in another video. Thank you guys for watching. Again, thank you for my new subscribers. I hope you guys continue to watch with me, grow with me, and I will see you all again in the next video.